Hello, everybody. How are you this afternoon? Welcome to Sanofi's booth. How are you? Still having energy? Yes, we have some clapping hands. We're ready for a great session. I'm sure you've been visiting all around, and Sanofi is obviously the best booth, of course. No doubt about that. And we have very interesting stuff this afternoon. And in the meantime, of course, I need to advertise also the corners if you want to have a look afterwards. And also startups, we will have later on some startups pitching also their solutions. So are you ready for this? That's great. We're getting better and better. Thank you very much. So let's talk about synthetic personas, AI synthetic personas, reaching basically patients and also doctors before we ever meet them. So for that, please welcome the digital product owner, Sydney Bossert. Welcome to you. Welcome to you.
Hello.
Happy to see you.
Nice to be
and
here.
to be finally on stage.
Yes.
So we are going to start with the problem, okay? Teams basically today have more and more data than ever, that we had ever, basically. But understanding the real people, how people react, how people basically feel, how people basically decide or we can engage them, it's still incredibly difficult to do that. So Sydney, what challenge are you actually trying to solve so that everybody understands?
So many digital and physical products end up
Bring
failing.
it just
Oh,
near. Yeah, great.
Sorry.
Yeah.
Thank you. Many digital and physical products end up failing. Any new digital and physical products end up failing, and many marketers have cited the reason as audience segmentation or lack thereof as being the biggest and most costly mistake. So with this audience disconnection, even the most amazing campaigns can end up falling flat. At Sanofi, we invest a lot of time and effort into ensuring that we have the proper messages for our audiences. So for example, what is a newly diagnosed patient with asthma? What's the best message for them? Or how do we reach a doctor who is about a new treatment for type 1 diabetes? The issue is that a lot of these conversations end up happening in a closed room without access to these patients and these doctors. So they end up being somewhat assumption-based, or if we're able to do user research, it can be costly and take a lot of time. And then once and even in some cases, the group you're trying to reach is such a small population that it can be hard to reach them. So then once you launch the campaign, it can be really hard to course correct. One of the things that we thought was best was that, sorry, I'm first time holding a mic. No, that we thought was best was, what if we could bring that into the room? What if we could bring those people into the room with us and have those conversations, not before it was too late, not before launching, but in the moment. We could test those messages with them.
That's great. So let's talk about basically AI synthetic persona. Let's get into the matter. If you had to explain to somebody who's outside of that field or even outside pharma in general, how would you describe it?
So I think a lot of us might be familiar with the scientific method, but essentially every good scientist, and hopefully every scientist, runs experiments before they draw their conclusions. They test against what their assumptions are. They don't just make the assumption and run with it. And so they challenge themselves, they challenge the hypothesis until they get to understand what is the truth. So we thought, why can't we do the same at Sanofi? Why can't every person do this before they send out a pharmaceutical marketing message or communication? So that's why we built Persona Lab.
Well, indeed, that's why you built Persona Lab. And let's illustrate that with a short video introducing basically the new AI-based solution that you have built. Let's watch it. Well, we hear a lot about digital twins, and we had a session about that earlier for clinical trials. What's the difference with synthetic, AI synthetic personas?
Yes, so a synthetic persona is actually a group of AI generated people who are built based off of combining data from hundreds or even thousands of different people. It doesn't represent a single individual, it's really a type of person. Meanwhile, a digital twin is a virtual one-to-one copy of an individual, so they're representing an individual from the real world.
So if I understand correctly, basically digital twins focus more on individuals in general, while synthetic personas help to understand basically patterns, behaviors, and reactions across a group. That's correct?
That's exactly it.
Okay, so before we go into the details, maybe let's discover another video, the
Yes.
practice of a persona lab.
Yes, and I will stand on stage because I'm going to kind of narrate for you. So here you're going to see the persona library. As a marketer or researcher, you would select a persona and start the conversation with them, explaining what the purpose of the conversation is, and it's to get an idea of how they feel about a message you want to test. So then you test the actual message you want to send, and you wait for their response. And then here we are seeing, we've highlighted what the persona says versus what real life users have said. So you can see where there's a crossover, a clear similarity. And this is super important for us to ensure that our digital personas, our AI personas, match what our users are saying, or it's very similar.
1, 2. Yes,
Yeah.
it sounds very promising, basically. But where do you stand today?
So today we've actually laid the technological foundations, so we were able to have the AI personalities and behaviors of our personas. They have human-like reasoning, meaning they think before they talk, and they can recall memories. And then you can also have live interactions, as you just saw, where you can create a persona, and then you can have a chat with them in live. And then we're also starting to test with our marketers, who are our first main users, so that we can gather feedback from them and understand their pain points, how we can make it better, and how we can improve across time and iterate with Persona Lab.
So if we go into the details now, how do you do this? How does it work concretely? Do you actually make a message, they react, you reiterate? How does that work?
Yeah, so the idea is that this is a living life cycle, that we don't just do one and done. You can have the persona, you can use AI personas throughout your whole campaign life cycle. So first, when you start with a message and you want to test the concept, you can use your persona to ask how they feel about it. Then from there, you can iterate and improve on the language, the tone, and even the creative. After that, you can start to actually see if how the channel fit is, meaning does David prefer an email, a clinical email summary in his inbox at 6 a.m., or does he prefer a concise visual in the middle of the day that he can scan between patients? After that, we would run it through some more stress testing to ensure that it's good for medical legal review, or it's more likely to pass. And then once it's launched, we get the real feedback from our users and can put it back into the personas so that they're constantly growing and learning, and that we can continue this throughout the life cycle of a campaign. So the idea is it's not just a one and done. It's there for you through your whole journey.
So I see, and beyond the technology itself, what are the benefits?
So traditional content testing has had a representation problem. It's not very easy to reach someone who has a rare disease that impacts 1 in 100,000 people, or how someone whose first language is Spanish is interpreting or understanding a message in English. At the same time, you're not going to hear someone who's been newly diagnosed with type 1 diabetes is going to hear a message differently than someone who's had type 1 diabetes for years. So the whole idea is that Persona Lab can help with make this more representative, make this more inclusive all around so that we can reach these people from the beginning, so that we can have their voices in the message. And in fact, it's not just good ethics, it's good science, because the more people we can reach, the more effective and efficient our communication ends up being.
I'm sure quite a few people here might find that stuff fascinating, but probably also the other maybe question that we can raise is, can we trust technology giving so accurately responses, reactions, human reactions?
Yeah. So responsible AI is at the core of everything that we build. At Sanofi, we have a framework in place for all of our AI solutions so that we ensure that there's governance, transparency, and a human in the loop at every step of the way. And what we've seen so far is that our users, our marketers, they're very excited about the possibility and the potential of this tool. And we know that once we're able to get the messages that have been approved or helped by the AI persona, and they resonate with the real people in the real world, that we'll have their trust. And that's our ultimate goal.
That's so we can trust and just human basically also supporting
Exactly.
to operate on that. If we look ahead, we said earlier that basically it's only the beginning. How do you see the future? What's looking ahead?
Yeah, we have big plans for Persona Lab. We would like that every Sanofian is able to access Persona Lab in their products, whether it be they're building a medical education content or a patient support program, or they want to test a feature that they're questioning if they should put in a digital product. We want them to have access to their potential users so that they can test right then and there, and get immediate feedback, so they can continuously learn and improve. And we also want to ensure that they have access to the answers right then and there. It's not stuck in a research report that is difficult to find and maybe difficult to interpret. You're able to have a conversation right then and there. And then eventually we want to expand our personas beyond healthcare professionals and patients. We kind of see that the sky is the limit with the personas that we could create, and so that we can really follow them, have them through the entire journey.
So let me come back on something that we can see in AI in general. How can we make sure that these personas are not hallucinating, basically, and that they're giving really the right answers?
Yeah, so we've actually we have our data that we get from market research, and the answers that the AI persona is pulling is based off of that data. They're not allowed open to the web, they're not scanning the web, so it's really based off of Sanofi data that our market research has done, which is great and comforting, I think.
I see. And can we make sure also that they're acting like real humans? How can we do that?
So to ensure that they're kind of in the video that I showed you, to ensure that they're acting as much like a real person as possible, that we can't ever be 100% sure. The only way that we can do that is by ensuring that we're cross-checking the real user data and the real user input against what our AI personas are saying, and do that regularly.
And how do you plan to deploy this tool throughout Sanofi?
So on a more technical front, we're building an API and agent so that our other products around Sanofi can consume and utilize personas, AI personas. But on a more, I guess, ethical or trustworthy front, we think that as soon as we start to use these personas and get get our marketers to use personas, and we see the messages are resonating in the real world, that will naturally gain their trust, and we'll continue to iterate. And yeah.
That looks very exciting. If we had actually to summarize, just wrap up everything, what should the audience actually remember?
So while I think this could be posed as, an efficiency play, this could be something like we're doing to, due for faster testing and slower or faster revision cycles, fewer revision cycles. In fact, it's about having better communication with our audiences, with the people that we're trying to reach, our healthcare providers, our patients, because better communication means better. It's better for everyone. The more that we're able to reach them and the more effectively we're able to reach them, that's priceless. So in fact, the idea is that we're getting to know them better, not just assuming that we know them.
Great, a great round of applause, please. Thank you. Do we have any questions for Sydney? Yes? It's coming, it's coming.
Hi, hello. Thank you, Sydney, for your presentation. It was very...
If you can, a little louder.
Yeah, very interesting. My question is about, do you plan to launch this solution outside Sanofi, or is it just only for internal purposes?
So for right now, it's for internal purposes.
Okay.
Yeah.
Right, thank you.
Yeah?
Hi, Sydney. Thank you for your presentation. This is a very nice subject. So I would like to know, how do you do this internally with the sales team? How do you boost it? How do you sell? How do you enable them to use this data normally?
So specifically for, you mean like how are we like selling it to be used, or how is our sales team selling
How are
it?
you like allowing the sales team use this data to reach more clients, like in a sales enablement part, like pitch decks and everything?
So that's, since we really are limited right now to the HCP, the healthcare provider and the patient personas, that's our main focus right now. Sales is in our list of exploration, so I can't fully answer that question right now, but it's something we're thinking about. Thank you.
Any other questions? Yeah?
Oh, hello. Yeah.
Hello.
Hello, Sydney. So, very nice presentation.
Thank you.
And I wonder how we could extend it to other internal personas, such as healthcare professionals, regulators,
Yes.
or even some regulatory strategies for internal profiles.
Yes. So this is also something this is also something that we're thinking through. It's, I mean, a big part of being able to have also the personas for different like regulatory or sales is also having a certain amount of data on like research, qualitative or quantitative. So this is, while we're focusing right now on the patient and healthcare provider, this is also, regulatory is also on our list of the personas that we want to build and have access to internally.
Fabulous.
Yes.
Any other questions? I do have one question,
Okay.
one last question. What is the science behind the technology?
Sure. So we're using different psychology flows, so cognitive flow, and also we're looking at the big 5 personality traits. So those are the main ones that we're using from like a science perspective. Yes.
I see. Any last question? Well, a great round of applause. Thank you.
Thank you very
Sydney.
much.
Great
Thank
job.
you.
Thank you very much. Well, don't hesitate to move around the booth. There are plenty of things to see. You can discover the R&D in action. You can also discover the patient experience through the tunnel. And obviously, manufacturing is also enhanced by AI. And last but not least, for the employees as well. So join us in about 15 minutes for our next session. It's quite interesting what's going to happen in 15 minutes. And we have also very interesting startups. So let's meet in 15 minutes for the next talk and move around and just discover all the booth. Thank you very much.